In this video, we'll be exploring the health disparities with chlamydia. So first of all, who is disproportionately affected by chlamydia? And the answer is the African American population. According to the CDC website, in 2018, the reported cases of chlamydia among African American women were 5 times higher than among white women, specifically 1,411.1 cases per 100,000 population for African American women and 281.7 cases per 100,000 population for white women. Among African American men, the chlamydia case rate was even higher, at a reported rate of 6.8 times the rate of white men, specifically 952.3 cases per 100,000 population and 140.4 cases per 100,000 population. The rates of chlamydia cases for age ranges of 15 to 24, which is the targeted screening range according to the CDC, was highest among African American populations in almost all, if not all, regions in the United States. So why has this occurred? This disparity could have occurred for any number of socioeconomic reasons that have been related to the history and systemic issues of the American society, such as the oppression of minority groups that has been seen throughout history. In some of these areas where the density of African American populations is relatively higher, there could possibly be significant lack of potential care for chlamydia and other STDs. Along with this, there could also potentially be less sexual education programs about STDs in schools, which would most likely lead to an increase in prevalence of chlamydia due to the lack of knowledge about contraceptives. Another cause of this disparity could possibly be the lack of ability to afford care or preventable measures for chlamydia in these regions. One of these proposed reasons is not going to be the sole reason for this obvious health disparity, but most likely it will be a multitude of these reasons, listed or unlisted, that has led to this disparity. So how has this health disparity been addressed? The plain answer is that it has not been effectively addressed. The CDC has gathered this information and presented it on their website for the public to read, but there has not been significant action to attempt to fix this disparity. It may have been superficially addressed through its acknowledgement by the American government, but efforts to stop the health disparity that African Americans are experiencing with chlamydia has been disappointing. Now that we've seen how the health disparity of chlamydia has affected the African American population, we can now look at, could it happen again or in another way? Well, the question is no longer could it happen again, but is when will it happen again? We've already seen a similar health disparity occur among minority populations with the most recent crisis of the pandemic with COVID-19. If this is already occurring with the most recent health crisis in this country, it is more likely than unlikely that it will happen again. Even without looking at COVID-19, health disparities among minority groups has already been seen countrywide with other STDs such as gonorrhea and syphilis, and other diseases such as the more severe HIV/AIDS. These health disparities are occurring in minority populations and are very serious problems in this country and are of much greater importance to fix than the United States currently believes.